Hi, Sci-Founder Fellowship. I'm Scott Goldman.
I'm Marc Verhoogstreet.
And I'm Marc Weir.
And together we are the team known as RISC, R-I-S-C.
As a professor at the University of Arizona, I study public health microbiology, and I'm really focused on how humans are exposed to pathogens.
And as a professor at The Ohio State University and an environmental engineer, I'm interested in using the data that Marc generates to be able to estimate human health risks and interventions to be able to maximize protection.
And as a former product manager at Lending Club, I'm interested in creating great user experiences around this underlying data of risk assessment. Together, our interdisciplinary team is focused on building a platform designed for infection preventionists to better manage risk and reduce disease. Our core technology will detect and predict the occurrence of drug-resistant pathogens to track how they persist and ultimately transmit through built environments.
So technology exists to measure pathogens in the environment near real time. And we also have the technology available to prevent human exposure to those pathogens. So using the latest state-of-the-art technology, such as epigenetic sensors, we can detect pathogens or their associated markers and stream that data via FastQ back to our cloud.
And then because we can get this data so quickly into a cloud, we can incorporate it into our risk and other systems models for us to be able to continuously train, update, and improve those models, but also provide the best, most precise estimates of health risk and give better options in real time back to the user of what are the best interventions for them to be able to choose from.
And we can roll all of this into a best-in-class user-friendly application that's general, but initially targeted at infection prevention teams so that they can measure their strategies in the way that teams build websites in modern applications.
Yeah, we have the experience in this team to complete each of these tasks individually, whether it's the technology or the exposure, the risk modeling, or the user interface. The barrier to achieving our ultimate goal up to this point has been dedicated time to bring each of us together, to bring and unite each of our components with a targeted end user in mind.
And right now, that end user is the healthcare system, healthcare workers, and the patients within these healthcare systems. Because every experiment and every research plan needs to have its grounding in order to be able to focus its work. However, through contacts that we have in other companies who focus more on the military populations and personnel and those people who are working within the space programs as well, what we're able to find out is that they have very similar, if not the same questions, but to a different user profile and personnel group. So what this means to us, and I think is quite clear, is that we have a broad set of possible users that we can expand into as we develop the company.
We're excited to combine our skill sets in microbiology, risk assessment, and customer development to get an MVP out to our core user segment as soon as possible. And we're excited to work with you, Sci-Founder Fellowship. Thanks.